Now to COVID-19 in our state. We saw a bit of a break in the number of new COVID-19 infections. The Department of Public Health reported about 2,400 new infections, and every day the state releases a lot of information about COVID-19. Christy Diaz joins us live from Fulton County. And Christy, the number of people who need to go to the hospital because of this virus keeps rising and creating problems.
Including diverting some ambulances to other hospitals as COVID cases rise. Now, it is important to note that diversions can happen for multiple reasons, even on a normal day, if a hospital doesn't have enough staff, beds, or equipment. So at this point, it's unclear how many of these diversions are happening because specifically of increased COVID patients. But here are the numbers we do know. The EMA says 16% of ICU beds in Metro Atlanta are open and that the emergency rooms have plenty of space. But even still, 3 hospitals had to divert ambulances to other locations, and 7 reported their ICUs were full. Now, GEMA publishes the number of active COVID hospital patients every single day, and that number is important because it's a key indicator of the severity of the virus. Regardless of whether you had a test, if you are sick enough to need medical care, you're going to the hospital. And as we track all of these numbers day to day, that number is rising. Francesca.
Christy, thank you.